My name is Rabbi Daniel Rabin. I'm the Senior Rabbi at the Caulfield Hebrew Congregation, also the immediate past President of the Rabbinical Council of Victoria. So some of the common questions I've received about the COVID vaccine has really been about two aspects. One is about, Rabbi, should I get the vaccine or shouldn't I get the vaccine? And of course, I always say this is a question for the medical professionals, for your GP. But people are also wondering, how does it work in terms of attending synagogue and religious services? They want to understand the new rules, and how does it work if you are vaccinated, you're not vaccinated, can they come, can't they come, having guests over. Obviously, when it comes to whether they should or shouldn't take the vaccine, I always tell them that this is a question for their medical professional, listen to the advice of the experts, and if they do have concerns, then obviously speak to their own local GP, the one that they go to for all other questions of this nature. In terms of coming to the synagogue, I work with the professional team at the Caulfield Shul. We do set up obviously strict regulations to ensure that we compliant with the restrictions and the different legal limits of how people can attend the synagogue. And so obviously just giving people an easy understanding of how that applies to our particular circumstance. So it's an excellent question whether the vaccine conflicts or fits in with our particular faith. And I have to say that I believe it very much fits in with our faith. Judaism places all seriousness and the value of life is at, I guess, the top priority. We always look at ways how do we ensure that life continues. Some of the laws, if somebody's sick or if somebody's unwell, we push aside many of the laws in order that they have their full health. And so when it comes to the vaccine, certainly if something can protect life and save life, then it very much fits in. And of course, I try and encourage people to understand that by having that vaccine, according to the experts, it of course will be saving a life. So it certainly is paramount in our faith as well. If people are unsure about taking the vaccine, I think the first thing is to have respect and patience and not to make judgments on people. But it's very important to encourage people to, as I said, to speak to people that they trust in the medical world. I was speaking to a person recently and they hadn't even spoken to their GP. They were concerned about the vaccine. And I said, if God forbid you had a lump or you weren't feeling well, you would go to your GP and you would trust them. So I said, if you're not certain, then go speak to those people who you have trusted in the past. And of course, if it's a matter of faith, speak to me. I'll sit down with you and I'll explain to you why it's so important from our perspective to ensure that everybody stays healthy and everybody, please God, can prolong their lives by taking the vaccine. So what I'm really looking forward to returning to face-to-face services is the sense of community. Really just being with people in the same room and being able to share, in joyous occasions, to be able to share in our daily prayers, our weekly prayers, and really just to be in a community. Till now we've done a lot of stuff on Zoom and of course phone calls, but there's nothing like being in a congregation in a big synagogue like this, where you see so many people coming together to celebrate and just to practice their faith in the way that it's been designed. Some of the steps we're putting into place, obviously we're following the guidelines as the government has provided them to us. We have COVID-safe monitors, we have pre-registrations, we have to, people have to upload their vaccination status to us. And so all those types of things, obviously social distancing, wearing masks indoors. And I think society as a whole in Victoria is really, COVID conscious. We do understand how to operate to keep ourselves safe with the hand sanitizing. And of course, as I said, if you do have a cough, don't attend, get tested if you're not feeling well. In terms of if anybody has suffered COVID-19 with the illness, I do know quite a few people who have had COVID. There have been a few in the community, in my community. And really, I think it's just about supporting them. A lot of people, obviously, because they can't leave their home for 14 days, we assist them with packages, and if somebody does have to go to hospital, of course we say prayers for them, and we just support the family around them as well who would need that extra support while they are hopefully recovering. In terms of coming back to synagogue and coming back to religious life and coming back to society, there definitely are groups of people who are still anxious about it. Now that we've opened up, and there are certainly a lot of people who I think are uncertain whether they should be coming to events or they should be coming to activities. Part of my encouragement to them is that of course we have to resume the way of life that we were used to. This is part of, for our mental health, for our social welfare and our social well-being. To be able to be together is important. But I think we just have to be tolerant and patient with people who do want to take a little bit more time, especially those who may be, more immunocompromised or who may be elderly, who don't necessarily want to rush into things. I'm putting no pressure on people to say you have to come back. So lockdown has been extremely hard in so many different ways. I spent 18 months doing Zoom talks and Zoom calls and welfare checks. And I saw how much it's impacted people's, as I said, mental health and just their overall well-being. And so I think people are very excited to come back, and I think it's crucial that part of life is we're social creatures. We want to be with each other, and we want to see our family members, we want to see our friends. And I think, coming back is going to, I think, hopefully enhance people's lives again as we go through this time, and people do get COVID. I think we have to not treat people as pariahs. I know in the early stages of the pandemic, it was like, oh, this person had COVID, let's not talk about it, let's not mention it. It's going to happen. People get the flu. Let's respect each other. Let's just make sure that we take care of each other. And at the same time, if you do have it, also make sure you respect others. Stay home, get better, and then come out. So it's important to, as I said, to just understand this is a way of life now, and we have to be respectful and kind and considerate of one another. I think that will help us really get through the pandemic in the best way possible.